Okay, welcome everyone. Today we will be discussing early childhood enrollment, and we are presenting in the month of June in 2024. Today we will be having a panel presentation from two of our colleagues across our state. I have Courtney Hatcher, who is a provider recruitment and quality specialist with Project Child in Mount Vernon, amongst many other hats and titles that she wears. Also wears the title, covers over 12 different counties in Southern Illinois. We have Mary Reynolds, who is the executive director of the Collaboration for Early Childhood in Oak Park. And we will be hearing from both of them specifically around enrollment strategies and procedures that they have worked on. And we will get to that in a brief moment. But first, I would like to provide a little bit about our learning objectives for today. Oh, and I'm Jacqueline Vasquez. I will be your supporting host today, leading our conversation, facilitating our conversation, and sharing with you these objectives first. Our participants that attend our enrollment conversation today will understand really the role of the collaboration in the enrollment process. What does our role look like as a community collaboration with both public and private partners? Also, we will learn about what our colleagues here, both Courtney and Mary, are doing in their collaborations to enroll children in programs across their communities. And hopefully we will each walk away with new strategies to support your current enrollment efforts. So I wanted to take a moment to provide a brief overview of the current state of enrollment procedures and practices in our state. Now, as you can see on the screen, I have two different charts. Figure one on the left is the children ages 3 to 6 enrolled in private and public preschool from 2019 to 2021. And this is information, both of them come from the US Census Bureau. And as you can see, the blue color is from 2019 and the orange is from 2022. And what we see here is that the percentage of 3 to 6-year-olds enrolled in preschool in the United States has dropped by 9.3 percentage points from 2019 to 2021. And this is all information that comes from the new US Census Bureau report. 4.1 million preschool enrollees in 2021 was the smallest number since the American Community Survey, or the ACS, began collecting data in 2005. And of course, this decline happens to coincide with the COVID-19 pandemic. And many schools closed because of the public health and safety concerns. In addition, there was generally many children were not attending due to the nationwide crisis, or the worldwide crisis. And the rate of total preschool enrollment is shrank by 6.5 percentage points in private schools as well, and publicly, and 2.8 in private schools. Now, if you look over to the right here, figure 2, the decline in US preschool enrollment by state, you'll see Illinois there is 9.0 to 11.9, which is a percentage point decline by state. And specifically, according to ISB, enrollment in pre-kindergarten at Illinois school districts decreased by 16% in 2020 to the 2021 school year due to the pandemic, but is slowly rising each year since. And pre-K enrollment increased by 8% for the 2022-23 school year compared to the previous year, but it still has not reached pre-pandemic levels. And this is really important that we are taking a beat to remember what has happened and where we are currently. And really, due to the pandemic, it was a decline that we've seen the first time in 20 years in enrollment numbers. And there were many different factors that were happening there. There were school closures happening. Remote schooling was definitely a factor. Many families found that it was just too hard to do with preschool. Funding efforts were, um, you know, it was really hard for many people to get the funding or maybe not in the timing that they needed, and just workforce issues, as we all know and have been experiencing. And there were so many different changes happening. We think about trust, the trust that communities already, many people were, and organizations and agencies that have spent so many years and time building that trust. And then when we have things like the pandemic and so many shifts and changes, trust issues then are back at the top of barriers and issues. Strategies to engaging families had to change and shift. It was very hard to find support to go out in the communities and, facilitate those connections. And of course, as I have above, as it is below, the changes in funding as always, and the overall adjusting landscape that at the very beginning of the pandemic seemed to happen on a week to week basis. And um, to this day are still occurring, as we know that there are generational effects and things that are still happening, as we are responding to the ever changing needs of our communities, but really what has happened over time and how we are rebuilding back. It is wonderful to hear and know that our numbers are growing and strategies are adjusting, and we are continuing to connect and learn from the community of the current needs. But we we really should always have that lens on where we were pre-pandemic and where we've been building since the pandemic. And that's where we're learning about the new and current strategies that have that different communities are engaging in. Some are able to go back to pre-pandemic strategies and continue to robustly build from there. And some have created whole new strategies due to the necessity and need of what has come from this time in our world. So, community collaborations play a significant role in pre-K enrollment by enhancing the quality and accessibility in early childhood education. Specifically, when I think about enrollment, it's expanding access. Community collaborations can expand families' access to high quality pre-K, providing more options for families, understanding the landscape of the community, who has slots, who has availability, what the qualifications are, and how to connect families in these warm handoffs and transitions directly to those places. This is also coordinated enrollment. This coordinated enrollment process can reduce the burden on families by allowing them to submit the single application for these multiple programs, or understanding um, where families need services or are eligible and can choose from these different options across the community. And also building consistent systems. Collaborative efforts help in building consistent and aligned delivery systems that strengthen early childhood systems at local and statewide levels. So, without further ado, I'd really like to connect you with our community partners here. Now, as part of the Illinois Learning Renewal efforts, the Governor's Emergency Education Relief, the GEER 2, funding was allocated to the GOECD, the Governor's Office of Early Childhood Development, to support development of an early childhood awareness and enrollment campaign that had statewide reach. Grants were distributed to 39 regions, covering the birth to 5 regions, covering all 102 counties across Illinois. INCRA, in collaboration with the Illinois Department of Human Services and the Division of Early Childhood, announced 39 grant awards for the ECEC Enrollment Community Outreach Grant. And the two communities you'll hear from today both received these grants. So first I'd like to have Courtney, hi Courtney, um, share a little bit about the work from the collaboration in Effingham County.
Thank you, Jacqueline. So again, my name is Courtney Hatcher, and I worked with one of the 12 counties that our office serves, which was Effingham County. And through the process, we established what we named the Effingham County Child Care Research Committee. And the committee's purpose was to research and identify underlying issues with childcare services, specifically in Effingham County, to develop a plan to overcome these workforce related hurdles and work with the county board on implementation. The 9 volunteers held various positions in the community, including childcare workers, a city employee, a county board member, parent, economic development agency employee, and a couple of other different positions. The child care feasibility study helped us identify and define areas of need among the community to find opportunities to support the county through the use of ARPA funds. And so, a little bit of background on how this committee actually was established was that pre pandemic, there were already collaborations happening with a couple of different groups of people who were invested in the field of early child care and had already kind of established committees themselves. And so what we wanted to do was after the pandemic and kind of got through that and people were starting to come back together again, we brought back the committees, both of the committees, and formed one so that we could all work for the same goals together. And so, a little bit of information about Effingham County. The population is approximately 34,600 with over 2,000 children under ages 5. And it's the meeting point of I-57 and I-70 located in the south central part of Illinois. It's approximately 7% of the families live below the poverty level, with an estimated 989 children ages 5 and under, which is 37% of all Effingham County children. And the race population is approximately 75% white, followed by Black at 13% and Hispanic at 5%. And I put approximately on all of those because we all know how those things change and data is a year to two behind. And so I feel confident that those are probably still relatively accurate, but I did want to note that going farther. So, some of the project goals that the Child Care Research Committee really wanted to focus on was understanding the landscape of child care service availability and emerging trends in Effingham County. We felt it was really important to understand not only what we had at that current time, but what we needed to look for in the future as the county was growing in population and in businesses and just overall growth. We also wanted to quantify current and future childcare needs in Effingham County. One thing that they mentioned that was really important was the continuing growth of the area. And so making sure that as people are looking at relocating or, um, creating more jobs and workforce in the area, that the childcare would be able to supply the needs for those specific things. The areas of research that we focused on were availability of early childhood care and education services, so identifying what those services were within the county and what their capacity versus child care slots, and then the trends and availability of early childhood care and education services, and then future demands for early care and education services. Out of the Child Care Research Committee, we actually broke off into 4 subcommittee programs. We kind of identified the 4 things that we thought were most important for the community based on having conversations with stakeholders in the community, having conversations with the current child care facilities and programs that were located in the community, and then also families that were using the services that were available. And so out of that, we came up with these 4 subcommittees, one being the retention committee. So whenever this all started to really come to fruition, it was during that time where we were seeing a lot of turnover directly after the pandemic, with childcare programs closing their doors because they couldn't continue to, sustain their programs due to funding, because people were not attending. It was also people were uneasy about being out in the workforce and being around children. And so we really wanted to put some effort into retaining the services that were already available in Effingham County. And so we focused on prioritizing efforts to retain childcare programs by proposing a stipend to each licensed family childcare home, group childcare home plus staff, and childcare center staff. And the stipend amount was based on years of experience to acknowledge the dedication of time in the field and retain the existing workforce. And so with that, we did create a rubric that showed the amounts per service times in the field, and we were able to successfully give those to all of the child care workers in the county, which was a really amazing thing that they really appreciated. We also were able to, in addition to that, give them some gift certificates to local businesses that wanted to also contribute in this effort to retain the current workforce. The second thing that we felt was really important was the GAP scholarship. Really was targeted to help families that were using childcare services and helping with financial assistance who, due to income level, did not qualify for the state's childcare assistance program. The intent is to support families that are financially strained due to the childcare costs that result in workers leaving the workforce. And so, kind of a dual purpose with this, we wanted to help families with the ever high costs of childcare, but also we wanted to retain them in the workforce because we heard a lot from local businesses that they were struggling to keep, their doors open. And so we thought this may be a way to not only help families but also help community in sustaining workforce and family costs being lower. Next slide, please. Thank you. The next one that we looked into that we felt like was really important was, again, we lost a lot of childcare programs and childcare staff. And so we wanted to look at increasing the capacity. And so we created a committee to help rebuild and increase childcare capacity through strategic business planning offered to existing licensed providers and individuals interested or in the process of becoming licensed. These participants engaged in a 12-hour workshop, and upon completion were eligible for a local grant. This turned out to be very successful. We had quite a few programs that participated in this particular effort, and we were able to help one of the one of the cities in the county open a child care center, and they didn't currently have any child care available in that area. So that was really a great thing that came out of this. We also were able to help improve some quality in some existing programs so that they were able to maintain their license and continue providing care and not having to close their doors. The last one that we looked at was the Community Facility Committee, and something that had been in the talks before we consolidated the two groups was looking at creating some kind of community facility that maybe partnered with local businesses. And so we took the past efforts from the research that had already been done, and we put that towards developing a community facility in Effingham. And we did investigate the possibility of partnering with existing provider or a local business or agency to provide on-site childcare services because that interest had been shown previously. But unfortunately, we were not able to have anything come out of that, specifically in Effingham. But we did gain some valuable information and was able to gauge where the interest stood. So some of the successes that we were able to put forth through the community of Effingham, we were able to give stipends to all the childcare workers in Effingham County. That was really wonderful, and we were very happy to be able to have that as a success right out of the gate. It was one of the first things that we did. We really wanted to really show our appreciation and retain what was already available. We did create the GAP scholarship and it has been implemented. We currently have, I believe, 6 families that are using the GAP scholarship program, and we continue to get the word out and let them know that funding is available. And so we're hoping to see that increase as time goes on. Capacity has been increased with financial assistance to open a new childcare center. Like I said, we were able to help with the creation of that, and so that was a really huge need that that community had, and so we were able to be a part of that big endeavor. Committee members were dedicated to this project. Really could not have any success with this project if the committee members were not dedicated. Nobody received funding for their efforts. They all did it on their lunch hours and in the evenings, and just really appreciate the dedication and the time that they spent understanding the field of early care and education, because many of them did not really realize the complexity that falls within this field. And so we were able to spread a lot of awareness of professionalism and understanding of what it is like to be in this field, but also appreciate the dedication of all the members that were part of this project. Some challenges that we had, community buy-in, believe it or not, was a little bit of a challenge. I think helping the community understand what the field of early childhood is, how it affects them, how it affects the community, how it truly is the foundation for the workforce, and how it can impact, many of the local businesses and agencies and things like that. And so, really giving that understanding in the community of what we're doing, why we're doing it, and why it's important. That took a lot of time and a lot of effort on our part. And then I feel like data is just one of those things that's always a little bit of a challenge. Being that we were kind of coming out of the pandemic a little bit when we started this project, data was a bit skewed. It looked very different pre-pandemic than post-pandemic. And so we really tried hard to get that local current data versus something that came, closer to the pandemic time. And so we did have to spend some extra time on that to really buckle down and make sure that we had, as much accuracy as possible. So some next steps of the Effingham County Child Care Research Committee. We want to continue awareness of the child care crisis. We still are suffering from lack of staffing, lack of qualified staff for programs. We are still not able to supply enough childcare slots for the amount of children that need services in Effingham County. And so we just really want to continue that awareness of the childcare crisis, that it's not solved, that we are still moving forward, and that there's still more work to be done. We want to also provide a continued resource to all programs and families. Now that the Child Care Research Committee has been established for 2 or 3 years now, we're hoping to have created such a rapport with childcare in that county that they look to us as somebody that they can come to for information and support. We would also like to sustain the GAP scholarship program. We're hoping that, unfortunately, as ARPA funds kind of run out and we move past that, we will still be able to work with the Effingham County Board in maintaining that GAP scholarship program for families. And then again, just promoting that professionalism in the field of early childhood care and education. That's one of the big things that we found was really, really important in understanding that it's not babysitting, that it is a career, that it is professional, and that it is really building the brains of those young children so that they can have a solid foundation for their life as they go forward. So thank you.
Thank you, Courtney. Now we will hear from Mary. And let me go to the next slide. Here we are.
Amazing. So thank you. I love learning about other community collaborations and what they do. And I'm taking notes of like, talk to Courtney about, these are such great ideas. So just briefly to give a little history and context about our work, we started as one of those fully volunteer collaborations, just like you're describing, Courtney, in 2002, working in Oak Park and River Forest, which are suburbs just outside Chicago in West Cook County. And since then, we've grown quite a bit, but holding on to that same mission and vision of communities where all children can thrive. So you can go to the next slide, and then pretty quickly the next slide after that. We grew very rapidly based on this mission and with these core values, looking to create systems of care that work for little ones and their families in what can often be a really fragmented and confusing broader system. And we grew from that totally volunteer-driven organization to, if you go to the next slide, you'll see the names of our whole paid staff team. And I love to highlight their names because none of us does this work alone. And each of these people has a bright brain and wonderful ideas and really helped us do the great work around our enrollment work and helps us continue to do our collaboration work. So if you go to the next slide, you'll see how cute they are and also how smart. That's our staff team. And I love them all so much. So if you pop to the next slide, you can sort of see the work that our collaboration does that has grown from that fully volunteer organization to who we are today, working across 4 primary areas that are interconnected. And I think you'll hear enrollment kind of tied up in each one of these. So we work in the early learning space, trying to increase access to and quality of early learning experiences for little ones. We work in the health and development space. That was really key, obviously, during the pandemic, catching and responding to developmental concerns early on, ensuring that children are connected to high quality pediatric care and follow-up care and supports that they need. We work in the family engagement space, obviously really connected to both of those, looking to make sure that families in our community know what resources are available to them and know how to access those resources. And then finally, working in the community engagement space, recognizing that ideally a whole community cares about kids and families and recognizes the benefit of a community where children can thrive. If you pop to the next slide, I'll just give some highlights from our last year. We do an annual community symposium, which is high quality professional development and learning for those qualified, not babysitter, high professional early childhood educators in our community. So we reached 300 people with that this last year. If you go to the next slide, one of our special projects this year has been an initiative called Social Emotional Tools and Techniques, or SETNT, because it's dynamite. Designed with educators in mind. We heard from educators, these kids are coming out of COVID with really different needs. My classroom looks different. My classroom feels different. I feel differently effective as a teacher. Send help. And so we designed this project in collaboration with early educators to bring an occupational therapist into the classroom to understand what's going on with regulation and fine motor skills and social development, and help teachers really expand their tools and techniques for responding to those. It's been a really fun project. The next slide just tells a little bit about the reach of our hearing and vision and developmental screenings across our community. Let's see, the next slide shows some of the reach of our family engagement work. So doing outreach and distributing materials and attending and hosting special events and things like that. The next slide is just an example of something that was really successful in this last year, also adorable. We had a costume parade, and that ended at the library for an early childhood resource fair. That was then this really fun opportunity for families to meet one another, engage in something joyful together, and get information about resources available to them. And then if you pop to the next slide, we do coordinated intake across our community for both home visiting and publicly funded preschool for all programming. And so far this year, we've reached 379 families, which is, and we still have 4 days left in the fiscal year, so that I'm certain that number will go up soon. Our next slide just tells you a little bit about one of our signature events, which is called Blast Off to Kindergarten. It's a community-wide celebration of our early learners as they head to kindergarten. And so really starts that process of transition from early learning programs into our public and private schools locally. That's a really fun event that, again, brings together families, community, and a ton of partners to help children make that transition smoothly and successfully. If you pop to the next slide, there's so much coming up, so much that is next steps for us, but really we're in the midst of rolling out this strategic plan for our organization for the next several years, looking to deepen our local impact. So understanding in the 22 years we've been here, what are we doing that still really matters? What are new needs that have emerged and how do we respond to those? Looking to widen our system impact. So one of the joyful things about this ECEC enrollment grant was the opportunity to work outside of our very local sphere of influence, which is great because obviously families navigate community and move across neighborhoods and resources differently. And then we're continuing to mature and grow as an organization and making sure that we're around for another 22 years and then 22 years after that to keep doing this great work. So I'm super excited to dig in more and talk with you all about enrollment stuff.
Thank you so much, Mary. Courtney and Mary, you provided so much for us to think about, and I know that many will want to reach out for some more information. But I figured we would just take this time to have a little Q&A session. Hope you have your coffee, tea, water. And so we can just have a nice chat. I'm going to stop sharing right now just so that we can see. There we go. I think a little bit better our screen here. And I want to start off with our first question. And that is, if you think about the demographics that you serve in your county communities, do you prioritize your outreach efforts? And if so, how are you doing that?
So we do try to prioritize our outreach efforts. I'm sure same for Courtney, really looking to reach families who may not otherwise know what's available to them. So who are the families who are most disconnected from access to resources? Who are families who have been historically marginalized and excluded, whether that's people who speak languages other than English at home, for whom accessing those resources is difficult, whether that's families who have fewer financial resources, so lower income families for whom, again, access can be confusing and particularly difficult. So we do try to look across our demographic and across different sets of data to understand where might utilization be lower and why. What are the unique needs in that pocket of the community, and how can we make sure that we're responsive to that? So if it's outreach, making sure that we have Spanish language folks who are going to do that outreach, for example. Working with leaders in those communities so that we can find those families who have been pretty historically disenfranchised or excluded and connect with them.
Yeah, and I would just say that, kind of the same for Mary. We really tried to be intentional. Being where we're located, we find that we are a lot of the same, and the diversity isn't as easy to find and not as large as maybe some areas. And so we really wanted to hear the voice of everyone, as much as we could. And so we really targeted childcare programs because they do have many families who come to the program. And so we really wanted to make that we actually created a survey, and we made that survey available to have them share with the families that used their services. We also reached out to local, like the health departments and the different offices that they had within there, and the library was huge in helping us get information. And then, also places of business, just providing that QR code so that they could scan it, take a survey, answer some questions, and, really feel like we did everything that we could and put all the effort in to make sure that as many voices were heard as possible.
I hear so much intentionality and resourcefulness, and really centering around the community voice as being key to these efforts, of thinking about who needs to be engaged first and identified to support. So I also think about your role as collaboration leaders and partners. Where do you see your role specifically? And think about the both the public and private partners that you partner with across your community. What is your role with each of them in enrollment?
On our side, I think one of our roles in enrollment is keeping the needs of children and families at the center of what we do. And I think about the early learning sector over these last several years, and boy, has that sector been through it. And that sector is also experiencing immense pressure to get their enrollment numbers back up, right? From federal funders, from state funders, from mission-driven organizations who say, why are our numbers so low? What is happening, right? And so I think sometimes that pressure leads to find the kids and get them here, find the kids and get them here, find the kids and get them here, without necessarily pausing to think, is this the right program for this family at this time? And I think our role as community collaborations, because we don't have that pressure on us, our pressure is find families, get them what they want and need, and help make that as seamless a transition as possible. So I think for us, it's holding that really, really front of mind and putting that front of mind and bringing the voice of children and families into that conversation as a starting point.
Yeah, I would absolutely agree with that. I think that that's really where we were focused also, was focusing on the families and the children and making sure that they are where they need to be, what fits them best, what's going to help them grow, you know, what's going to meet the needs, right? Because that's something that we were really looking at is, we want to make sure that needs are being met. And when we see that deficit, we try to figure out how can we help, what can we do? And obviously there's not a one size fits all. So it's trying many different things until you find something that you're like, hey, this actually works and we can run with that and expand on it. And my agency is a child care resource and referral agency. And so as far as public and private, we are here to support in any way that we can, whether it's through professional development, whether it's through, giving tips and tricks, whether it's just being that person to listen when they have a voice that they need to share, and somebody who understands what their day-to-day job looks like, and their responsibilities. And so, really just letting them know that there is that support and that resource out there to help them continue on their journey and sustain, and, be able to continue to not only help families find those services that fit them best, but also to provide that support and stability for those services so that there are many options for families to choose from.
Centering the child in your agendas and not having organizational agendas is the theme, but really the heart of your work. And I'm so appreciative to hear that piece coming through loud and clear. And then also really thinking about the supports and systems of those that are supporting children and families, knowing that it is stressful. Thank you for calling that out. It is hard. There are a lot of pressures. There are a lot of, you know, our landscape is still ever changing. And having those professional partners to lean on for support is so wonderful. And hearing all of this, can you speak a little bit more to, I know that these we're talking about different strategies, but what are those barriers in getting these strategies going? And what other issues are you facing in trying to move this work forward?
I think Mary's letting me go first on this one. She's starting to squirm a little bit. Uh, so I know in Southern Illinois, one of I think the largest barriers is finding qualified staff. The staffing crisis happened far before the pandemic ever came about. And, finding qualified staff, finding people that understand what this job looks like, and that it's not just babysitting and it's not getting to play with children all day, but it's a learning environment, and that it's professional. I think a lot of people go into this field thinking, oh yes, I love children and I just want to play with them all day. And absolutely that's part of learning. But there's so much more that comes with it. So we really have a lot of staff turnover, and then we have a lot of people who don't really understand early care and education, and that it's before the public school system or the private school system, that it happens at birth through. And so really helping people have that understanding of what this field is and the professionalism that comes with it and all that it entails. Um, so we really, have spent a lot of time on that. I know that I talk to many people and they say, I would love to open a childcare center or expand pre-K, but either A, I'm afraid I can't get the staff to fill it. We currently have a program who has a prevention initiative grant, and they are coming down to the wire and may have to possibly give it back because they can't staff the program. And they've been trying for months to get the staff. And so, and it's not just our area, I know it's everywhere, but I feel like it's just a continual conversation. And all of the things that are being put in place to help with that have been amazing. But we're still several years out before we're going to reap the benefits. And so the struggle continues. And, we just still feel it very, very heavy. So I think that's, probably one of the biggest barriers in our area.
That the staffing crisis is real and legit. And I'm adding to that, I think we're both thinking about sort of systemic and structural challenges to this. And a big one is a mismatch between what children and families need and what's available. So whether that's a program that offers transportation is a giant barrier for families getting plugged into the kind of services they need. Whether that's more creative and expansive thinking about how we serve children with developmental disabilities or delays, right? So thinking about a child who perhaps needs early childhood special education, early intervention services, and who has working parents or caregivers who need that full day extended care. And the challenges of staffing issues, right? If we need more one-on-one assistance for this child, if we need a smaller classroom environment for this child, how our programs are able to do that while also working on the margins that early care and education programs often work on. So I think for us, one of our big barriers that we see a lot is that disconnect between available slots and what families need. Sometimes we look at our slot availability and we think, gosh, we have tons of available programming in town right now. A family calls and they say, here's what I need. And we look at what's available and it's a mismatch, right? So part day programming that doesn't work unless, ABC conditions are in place. So I think for us, those are also barriers that we're looking at that are tough for us as a collaboration to solve individually, that really require a lot more collective thinking and resolution.
And policy changes, absolutely. I think many across the state and nation could resonate with, the barriers you're both facing. And I want to ask a little bit further into this question. I know both of you are in very different areas of the state, which speak to different types of strategies and different challenges. Can you speak to the barriers or issues you may face in a highly populated versus a very more rural area? Uh, yeah.
I mean, I think highly populated, it looks like we have a ton of resources, and we do, but we also have a ton of people. And so oh gosh, you have 38 licensed centers in your town. Yes, and we have a slot gap. So it's this like, oh my gosh, just that, I think that for us is the challenge, is just, although it's densely resourced, it's also densely populated. And the diversity that comes along with a very diverse sort of ecosystem here means language needs, family structure needs, child needs. They're really expansive, and it can be tough to get our arms around, okay, which programs have someone who speaks Polish right now? Okay, which programs have a Spanish speaker on staff right now? So just kind of keeping up with really rapidly shifting population demographics, I would say, for us.
Yeah, I think even though we are quite a bit smaller, I think that we face some of the same challenges. It's, yeah, we're a smaller area, and maybe our population isn't as heavy, but we still are lacking in resources and in available slots for childcare. Effingham, in particular, has off the top of my head, 5 or 6 centers, which sounds like a lot for a population of 34,000, but it's really not. And, even though there is, approximately 31 family childcare homes, sounds like a large number, but when you look at capacity versus slots needed, it really does not, it doesn't accommodate. And Effingham being one of the bigger areas in Southern Illinois, still they have a lot of gaps in services and accessibility to some of those services just because of the location. And so, yeah, I think that Mary and I are in very different areas, but still face many of the same challenges, just in a little bit different way.
I agree. Um, Now, let's talk about now. Courtney and Mary both have highlighted some of the really great strategies that you have done in the past, maybe still working on. Uh, I think before we complete our time together, I'd love to really highlight again some of the strategies and how you went about, um, you know, getting them started, to give others maybe some ideas on how to move forth on some of your great strategies.
All right. Well, I'll go first. So one of the things that we really prioritized was having a variety of stakeholders that were part of this process. We really wanted to make sure that we had many different things represented in our collaboration. We wanted parent voice for sure. We wanted the early education field for sure, but we also wanted people that were stakeholders in the community and that didn't necessarily have a vested interest, didn't have children that were young and using care or using services, but had a different perspective. And so we really tried to make sure that we had a lot of various representation within the community, just to have kind of that different lens, right? So to ask those challenging questions about the field and, well, why doesn't this work? Or why can't we do this? And be able to just kind of speak to that. We also felt that that benefited getting the word out as well, and not just kind of secluding it in our own field, but also, reaching all of those other people and then the people that they come in contact with. And so kind of, being able to spread the word a little bit further. And so I felt like that was a really key point that made ours successful. Something else that we did is we did a lot of interviews locally. We did interviews with the local newspaper. I don't know if you guys have that in your area, but we still do that a little bit in ours. We did different um, interviews and things on the radio, just local community type of opportunities, that anywhere we could talk about it, anywhere we could speak, anywhere we could share, somebody from our committee would go and represent. And I feel like that was to get really those grassroots and get those people within the community aware of, these are what we're trying to do, these are the efforts, these are the problems, these are the things that we're facing, now and going forward. And really providing the opportunity to reach out and get whole community input. um, we also did a lot of advertising on social media through different outlets. We used I 3 or 4 different outlets within the community that had active Facebook pages and other social media types. And so, really wanted to be diverse on how we advertise what was happening and spread the word about, all the things that we were planning to do and all the things that we had done also. So just a little variation in things.
I think similar. I'm hearing one of our strategies is just be everywhere. Like it sounds silly, but like be visible. And I think community collaborations are really good at that because you build community champions. So whether it's staff or volunteers or parents and families who benefited from what you do. Having as many ambassadors out there sort of speaking to the importance of the resources that community collaborations can offer is really important. And one of my most favorite stories about this is someone on my team forwarded me an email from early March 2020 from a parent who had then responded to that same email in like May of 2024, 4 years later, right? Had reached out in early March of 2020. Hey, I was wondering if you might be able to help me with XYZ issues going on with my kids. 4 years later, responded to that email and said, hey, I'm coming back to this. I'm ready now. And it makes me laugh because it just sort of says, like, you never know what seeds you're planting. And sometimes, you know, our team was out the other day at a farmer's market in the rain. They were like, we talked to one person. Like, that might be the one person who 4 years from now remembers that you were nice to them at the farmer's market and knows that you're a resource. And I think that's this really important thing, is to not underestimate the importance of those relationships and that visibility. And so being out there, our outreach team will often say, gosh, finally this parent came up to me and said, I've seen you at like 10 things this summer. I could use some help figuring out what to do with my child who was recently diagnosed with autism, and we need childcare, and it's a tough thing to figure out. But it took that trust, Jacqueline, getting back to something that you mentioned back at the beginning, it took that trust, it took that consistency, it took that visibility in the community before a parent really realized, oh, maybe they are here to help me. Maybe this is a safe person to ask for help with what I need. And so just to really recognize the importance of persistence, consistency, and visibility across every possible channel. I would like people to be sick of seeing us, to be honest with you. I want them to know so much that we're here that they're like over it. So that just takes really intensive work at saturation across every possible angle that we can get our hands on.
It does, and it doesn't happen overnight. It is something that you have to be, you know, consistent, diligent, go time and time again. Um, I wonder also if you could each speak a little bit to the role of data and the type of data that you're pulling. I know, Courtney, you spoke about local community, real-time data. How did you capture that? Who was at the table? And I think that just speaking to data and the power that it serves with your outreach efforts.
So data is the bane of my existence. Just going to start with that. It is something that I struggle with. I love data. I find it fascinating. I appreciate the work that goes into it now that I've done a little bit of it, because it can definitely be challenging. We are fortunate enough to work with INCRA, and they provided a lot of the data that we needed, kind of, you know, for the overall. But what we really did was we made a lot of phone calls collecting specific information from programs. As a child care resource and referral office, I have some of that information on hand that we keep in our database, but I also wanted to reach out to programs and really make that connection with them and find out specifically, you know, the information that I was seeking. And so finding out if they had classrooms that were still closed and how many slots that they could fill with that, what age group that they, you know, were finding that was hardest to fill, or just have a waiting list that is 100 miles long. But really, we put the intentionality into speaking with the local programs, and, you know, finding out where those gaps and in services, and finding out what age group had the most need, which we found was birth to 3. And I'm sure that's probably pretty common because of the capacity sizes are so much smaller. But it was really eye-opening to be able to pull that and see what we already knew, but what it actually looked like. And so we did spend a lot of time just reaching out locally and taking the data that we could get from INCRA and then comparing it with the current data that we could get from programs and just kind of seeing where we were at. And unfortunately, we were upside down. We had programs that had mile-long waiting lists. We had programs that had classrooms closed. We had programs that had staffing issues, all of the things that we thought, but we were able to get a much better understanding of what it looked like.
I think agreed. I love a spreadsheet. I never met a spreadsheet I didn't like. And working with data, it's frustrating because there's so much that seems like it should be easily knowable that is not accessible, right? And so in trying to tell the story of early childhood, that it depends is always the answer, right? Because you can't ever get a full count of mismatch between slots and needs. You can't ever get a full count of who's needing services and unable to access it. You can't ever really know. So we try to use publicly available data and work with our partners to get access to that. We try to collect information, I think, Courtney, as you're saying, across sort of standardized what our programs in town are doing. We also try to get ongoing feedback from families. So we do, family surveys and a lot of outreach. But I think it's important for us to know too, that just because there isn't 87% of families said this data point doesn't mean that it's not true. And so figuring out how to tell those stories, when anecdotally we hear often enough, the biggest barrier for me accessing early care and education is the cost, or is transportation, or is whatever. So a lot of times we also will get our hands on a smaller data set or a national data set and fact check it locally. So like, hey, family advisory folks, we're hearing this. Is that ringing true for your experience, or is it different here locally, right? And so figuring out sort of the multiple ways to tell this story and figure out what it is that we need and how to advocate for it.
Thank you. Now our time is coming to an end, but I have one more question, just one more. And there are so many new early childhood collaborations that are now being funded and getting started. What is your one piece of advice to get started in their outreach efforts and around enrollment? If you could give them just one nugget of wisdom, what would it be?
I mean, I think
Uh,
Courtney sort of already mentioned this, but one nugget of wisdom is that everyone needs to care about this. And so figuring out why it is that someone should care about it and being ready to pull them in as a champion of your mission. There's a coffee shop near my office, and the owner the other day was like, well, what is it that you do? And I said, oh, let me tell you why this matters to you. This is your future workforce. This is the people who will have the money to spend $7 on this beautiful latte here and sit here and do their work from your coffee shop. You care about this because of economic development. Great. So finding like what it is that makes someone a champion of your cause and bringing them on as early as possible, and never assuming that like, oh, they won't care because that's a senior citizen focused organization, or they won't care because they're really focused on recycling. Early childhood is everybody's business, and make it make it clear why, I think, is my best nugget.
Yeah, I would 100% agree with Mary. Finding people that are like-minded to help with all of the efforts that because if you don't know why you're doing it and you don't understand why you're doing it, it's not going to be productive. And so really finding that group of people, because at the end of the day, there's going to be hurdles. And the best thing that you can do is accept those hurdles, embrace those hurdles, learn from those hurdles, and just keep jumping. Because it really is, the ending is always sweet, and you just have to realize that, no matter what you have to go through to get there, that the ending will be sweet and there'll be something good that comes out of it.
just keep jumping. Thank you so much. I've had such a great time with both of you, learning about what is happening in both of your areas, the work that you have done over time and are currently moving towards. And thank you for sharing your wisdom I think that so many will be able to resonate with the barriers or issues that you've been up against, and understanding that everybody has this ongoing effect from 2020, and are all trying to rebuild. And why work harder when we can work smarter and learn from each other? Thank you again. And I'm so grateful for our time together. Have a great afternoon, and we will talk to you soon.
Thank you so much.
Thank you. And recording.